everyone, this is Dr. Scholz here at Scholz Chiropractic and Wellness. I'm just going to do a quick video today to kind of show you how a chiropractic table works. So every chiropractic table is a little bit different, but I'm going to kind of show you how my Hill table works. So the Hill Airflex table is actually built on an air compressor system. So you're going to hear some noises in the table. Basically, the first noise you're going to hear is that it actually automatically calibrates to the patient's weight, which is really cool. Kind of like an added feature of this table, which is really cool. That's the noise that you're going to hear there. The other noises that the table is going to make are what some of the things are going to be like drop pieces and a flexion distraction that this table also does. Now, flexion distraction, and I'm going to try to show you this quickly. Okay, so I'm probably going to get cut off in all of these videos, but I'll try to do it as quickly as possible. So we were kind of talking about the benefits of flexion distraction. So it's basically going to allow the low back to stretch. It also opens up disc spaces as well, so it helps with disc-related injuries in the low back, and it also just helps in general with some tension and pain for low back. So basically what's going to happen, and the table's going to make some noise as it does this as well. So the pressure is going to kind of change depending on the patient, what their needs are, and then the table is going to go up and down. So I'm going to kind of show you how this works. So the provider's hand is going to go on the patient's back, and then the table is just going to go up and down like this. It's a very simple technique, but it's very efficient, and it's just great for assisting with low back pain and opening up disc spaces. Now the table is going to lock back, and then I'm going to show you how the drop pieces work on the table as well. So drops on a Alright, so getting back to the drops on the chiropractic table. So basically the purpose of drops is it's just another technique that we can use to allow joints to move back into their proper positioning. I'm a big fan of drops. I think they're great. They're also really great for people that don't necessarily like being twisted or put in specific positions. Also really great for pregnancy because the patient doesn't need to be placed on their side. So basically what's going to happen is the drop pieces are just going to come straight up like this. And then it's just going to be compression, straight down, pressure here, and then pressure here. So they're a little bit louder, but that's basically just why the table makes that noise. So another thing I wanted to mention as well for pregnancy is that the table is going to allow for us, it will shift down for the belly right here. So there's a drop down, and then there's going to be pillows that go on top to make pregnancy a little bit. Okay, so really quick, getting back to that drop piece for pregnancy and the pregnancy pillows. So there's going to be two pillows, different sizes. The smaller one's going to be for earlier stage pregnancy. The bigger pillow is going to be for later stage pregnancy. We can also put both of them together to make it a little bit thicker. We can put it kind of like more horizontal. We can put it vertical, whichever way kind of works best for the patient. So the nice thing too about the table is that we can still put the pillow on the table, and then we can still use the drops. So drop pieces are still going to work the same, and then the drops are going to be right over the pelvis and upper back, mid back area as well. So if you guys have any questions about other parts of the table or what we can use it for, feel free to